The COVID-19 pandemic reminded us that diseases have no borders and can affect the entire planet. That is why we need international collaboration and global participatory responses. Because health is a human right, and governments must guarantee it to all people, especially the most vulnerable. At Medicus Mundi, we work towards global health so that everyone around the world can enjoy the highest level of physical, mental, and social health, so that unfair and avoidable inequalities disappear. To achieve global health, we must take into account all health factors. Health is not just an individual responsibility. There are increasingly global factors that determine the health of the planet. Healthcare. Equal and universal access should be the priority goal when talking about global health. However, the biggest problem we face is unequal access to health services. At Medicus Mundi, we believe it is necessary to reflect deeply on primary health care, or PHC. Because primary care does not just solve most of our health problems, it is also the space in which people actively participate to build global policies. From the bottom up, Medicus Mundi is committed to global public governance in health, to reform and strengthen the World Health Organization so as to make it more effective and independent, and with greater civil society participation. Socio-political factors. We live in a globalized world that promotes individual well-being over the common good. The enormous gender inequality makes women more vulnerable in all areas regarding health. In addition, they are underrepresented in discussions on global health priorities worldwide. Inequalities in social class, age, ethnicity, and territory also largely determine health levels. Medicus Mundi advocates for a more inclusive society, where gender and other perspectives are always present. Food. The world is moving in a cruel dichotomy. A large part of the world's population suffers from malnutrition. However, more and more people are overweight. The world food market is a big business in which multinationals impose their prices and richer countries decide the rules. Their production methods degrade the environment and our health. Meanwhile, 30% of the world's population live in food insecurity, and millions of farming families cannot make a decent living from their work. Medicus Mundi economically, socially, and environmentally supports sustainable food production systems to provide safe and nutritious food to everyone. Economic factors. Poverty affects people's health levels. There is structural poverty, one that comes from the economic model and not from our individual actions. This economic model prioritizes the infinite growth of corporate profits. That is why 62 people have the same wealth as half of the planet's population. This model encourages competition over alliances and promotes irresponsible consumerism. It is based on infinite growth that is impossible to achieve, as our resources are limited, and we have already fully exploited them. Medicus Mundi believes in an economic model that is sustainable, more equitable, one that places rights such as health over the commercial interests of a small part of the population. The environment. For people to be healthy, they must live in a healthy environment. The current global economic model puts the planet's ecological sustainability at risk, and with it, the health of its inhabitants and future generations. Climate change is beginning to have terrible consequences for people's health, especially those living in the most vulnerable regions. It is a priority to analyze the causes of climate change and establish urgent and comprehensive public health policy measures that reduce its consequences. The planet can live without humanity, but humanity cannot live without the planet. We are facing enormous global challenges. Access to health is increasingly unequal. We see new pandemics emerging and inequalities growing. Pandemics, such as the one caused by COVID-19, further increase the gender gap and violence against women. Rich countries are gaining privileged access to vaccines. The poorest ones are still waiting for their turn. At Medicus Mundi, we continue to work for effective, efficient, and sustainable global and public governance of the planet's health problems. For the universal right to the best possible health for all people. Because your health is also everyone's health.